And now, Thomas Jefferson University Hospital's leader in fake news. This is JHN News.
And now, reporting on the biggest scandal that has rocked Thomas Jefferson Hospital in the last year. A resident physician has been found to be abusing drugs. Dr. Abdul Jalil, once thought to lead a life free of excesses and temptation, has been found to have a positive urine drug screen. Mrs. Lisa Sharp, who is the she does something, I don't know, important at DuPont Hospital, has leaked the report, yes, that Dr. Jalil has a positive urine drug screen. I interviewed Dr. Jalil in his office yesterday. Dr. Jalil, thank you for meeting with me today.
Thank you for having me.
Okay, so we're here to talk about your urine drug screen. I've heard that you had a positive result.
Yeah, that's...
Can you explain this?
That's true, yeah. But I have an explanation. I had a huge breakfast where I had a poppy seed bagel, so...
So it can lead to a false positive.
Yeah, but I also had a marijuana brownie and a opium tea, I have to say.
The truth comes out.
We have an update on the disappearance of renowned neuromuscular physician Marino Stalakis. He was last seen here in Philadelphia in 2008. All subsequent sightings since then have unfortunately turned out to be hoaxes. The 2-year manhunt has appeared to have come to a close, as we have this photo, courtesy of a German photographer stationed in the jungles of Borneo, of what appears to be Dr. Stalakis. Hang on. This just in. We have a man transferred from Chestnut Hill Hospital who actually has a stroke. The stroke robot, as depicted here by Johnny 5 in Short Circuit, has facilitated the care of an 85-year-old man who was last seen normal at 8:52 p.m. Sorry, false alarm. It's a Bell's palsy, the etiology of which is unknown. What? Okay, false alarm. It's bitter beer face. The guy had a sip of some especially hoppy beer, and it's just bitter beer face.
In local events, Dr. Christopher Skidmore, program director at Thomas Jefferson Neurology, suddenly quit last month, citing frustration from the recent ACGME site visit. An actor portrayal is shown here.
And here's the actor portrayal of Dr. Skidmore's departure. After months of ACGME paperwork, the man is simply fed up and snaps. He goes on a rampage and nothing in his path is safe. First he comes across some academic journals and aggressively throws them into the air. Next he spots some paperwork. Viciously throws it to the ground. Oh no, next is the iPad 2, he's about to throw it to the ground. No, he kisses it because that's his baby. What's next on his path? It's a resident trying to ask a question. And this young man later dies of head trauma.
Taking his place as interim program director is his evil twin, Dr. Christopher Skidless. We will now show you our exclusive interview of Dr. Christopher Skidless. Please stay tuned.
How are you today, sir?
I'm doing fine. How long is this going to take? Because you're kind of taking up part of my day.
I'm wasting your time, probably just a few minutes.
Okay, just make it quick.
Okay. So tell me about yourself. I understand that you're Dr. Skidmore's evil twin?
That is correct. Some people would say that evil. I mean, what does evil really mean? I'm the better twin, clearly. Much better than my, goody two-shoe brother, who's, always abiding by the rules and is much more kind of square, Do you think my brother could grow a mustache like this? Absolutely not.
I see. And this is an evil mustache, correct?
Absolutely. It's taken me years to perfect this mustache.
Okay, very good. What do you think your policy on the ACGME is as compared to your brother?
Oh, my brother, he was always so stuck up with these ACGME and all the different rules and regulations they have. I don't care about the ACG. I care about me. Me, the best evil program director you're ever going to have. Okay, that's the most important thing. Who cares about the ACGME? I don't care about this residency. I'm already done. I already got my residency. So if they shut us down next week, all right, so I got to go find a new job. No big deal.
I see. And how do you think your residency experience differed from your brother's?
Oh, my brother, he loves to talk about his residency experience. The big, famous Cleveland Clinic, where he trained under all these great people. You know, I was in Cleveland as well for 5 years. I was in a methadone clinic there, and let me tell you, my experience is just as good.
I see. So you're in the Cleveland Methadone Clinic.
That's correct.
Okay, so it's comparable. Okay. And what kind of changes have you made to the program? Have you had any new hires since you've been on?
We hired a new stroke attending. I'm very excited about this. He kind of has a similar philosophy to me. His name is Dr. William McHusband, and he's really going to be quite ruthless with the residents.
I see. This is the evil twin to Dr. William McBride, his McHusband.
I have an evil mustache too.
And how are you going to improve resident education while you're here?
Well, you know, I was very disappointed. One of the first patients that was presented to me, you know, the resident came and said they had 1 out of 5 power. I went and examined the patient. It was clearly 1+. Like, how could you be so stupid to miss 1 versus 1+? So we're going to spend the next 6 months examining every single patient in detail to make sure every resident knows 0, 0+, all the way up through 5+.
I see. Any changes to the headache program, or you want to leave it as is?
God, the headache program. I went down there one weekend so far at Methodist, and all those patients wanted to talk about was how their head hurt. They wanted to give me some number from 1 to 10 of how their pain hurt. I believe that we should give ketamine to every single one of these patients so I don't have to talk to any of them on the weekend.
Okay. All right, well, there you have it, Dr. Skidless, and how he's running the new program. Thank you,
And
sir.
get the camera off of him. Take one last look at this mustache. Years in the making, this mustache. All right, now get out of my office.
And more in local news. Jefferson Neurology and Neurosurgery will have a new home in the heart of Philadelphia. The construction has already begun on the corner of 9th and Walnut Streets. Reporting live from the construction site is correspondent David Rochelle. David Rochelle was supposed to be there at 9 a.m. He's not on site? Where is David? It's 9:30.
Am I late? Sorry, but I had to stop by the Wawa to get this delicious breakfast sandwich.
David, but it's 9:30. Cameras were rolling at 9 o'clock.
But this is my breakfast sandwich we're talking about. But listen, I'm sorry, it won't happen again. I promise.
David.
Laura Santamaria reporting for JHN News. Half of Rodney Bell is missing. Last spotted at the beginning of the academic year, half of his body mass has vanished without a trace. This is the second such incident according to Dr. Bell, his hair having gone missing in the late 1980s. If you have any tips about its whereabouts, please call 1-800-JEFF-NEWS now. Thank you.
Lori Bolin with JHN News. As summer rolls around, I'd like to discuss an issue that's very near and dear to my heart. As you may or may not know, June is National Porphyria Awareness Month. Porphyria is a disease that's not nearly as rare as you may think. It strikes as many as 1 person every million years. Symptoms of porphyria include hysteria, anxiety, psychosis, stomach aches, and heart palpitations. Symptoms of trying to diagnose porphyria include anxiety, hysteria, psychosis, stomach aches, and heart palpitations.
Good day. This is David Rashab reporting to you from the Neurology Situation Room at JHN on major events in sports. 20 neurology residents were in a sailboat regatta today when they just suddenly stopped. What took the wind out of their sails? Speech at the Philadelphia Neurological Society. And now to Shatabdi Patel to present to you a new sensation that is sweeping the country today. Shatabdi.
Hi, I'm Shatabdi Patel, and more with sports news today. Yes, David, it's athletic, it's flexible, it's man yoga. Once considered an activity exclusively for Eastern mystics, and more recently, suburban housewives, the trend has now spread to the men of Jefferson Headache Center. At the end of the news hour, too many mics? Since Thomas Jefferson Hospital has exceeded its quota on mics, we will not be hiring any more mics in the next 10 years. After hiring Mike Sperling, Mike Masudis, Mike Marmira, Mike Silver, and Mike Stitzer, the Human Resources Department has forbidden any more Mike hirings till the year of 2021. That concludes your daily JHN News for June 10th, 2011. Thank you and have a great day.
I understand that you came up with a 5++++ to evaluate your own strength. Is that correct?
Of course. I mean, you know, just kind of twirling these things here, you get superhuman biceps. I mean, come on.
This month. Porphyria is a disease.
That'll be in the paper.
Okay.
Okay,
Disassemble.
Wait, no,